Benefit managers, or PBMs, is ramping up not just here in Arkansas, but on the federal level. A bill making its way through Congress is looking to crack down on inflating prescription costs for patients. Samantha Boyd details how the bill could reshape the pharmaceutical industry.
The fight against pharmacy benefit managers is not over yet for lawmakers at the state capitol and the U.S. Capitol.
I don't think H.R. 9096 would have ever been introduced if the state legislature of Arkansas and Governor Hutchinson hadn't called a special session in 2018.
Arkansas is one of the states leading the nation in strict policies pushing back on pharmacy benefit managers said to be ripping off both pharmacies across the state and consumers. The state insurance department is now able to enforce an emergency rule under Arkansas law that allows the state to fine PBMs who do not adhere to the original state law, which requires them to pay pharmacies a fair and reasonable rate.
These actions by the governor of Arkansas, the insurance department in Arkansas, U.S. Congress are happening because of the Federal Trade Commission report that was released in July. The evidence is showing that while they cut reimbursement and access locally, they overcharge and overpay themselves.
The three largest PBMs argued in a federal congressional hearing that drug makers are responsible for overcharging on these drugs to patients. And they said their plans actually protect patients from high healthcare costs. Though this legislation, known as H.R. 9096, aims to ensure community pharmacies can provide care to patients enrolled in federal healthcare programs, specifically seniors covered by Medicare and Medicaid, government employees, and active duty service members. It also ensures those pharmacies are being reimbursed fairly and transparently by PBMs.
The patients in those three plans make up 30% of our state's population. So we can fix 70% at the state level, but without Congress also taking action, there's still a lot of patients who lose access and are overcharged.
That was Samantha Boyd reporting. Well, how does a raise sound? What if the raise was just an extra $89?